Hello students, welcome to this session. It's about anatomical terminologies where we are going to learn about the basic terms in anatomy. Shall we start? So here we are going to learn about what is anatomy, what are the subdivisions of anatomy, what do you mean by anatomical position, anatomical planes, and then different terms of comparison, laterality movements. Okay? Yes. So what is anatomy? Anatomy is the study of the structure of the body. What is it made up of? What are its constituents? And the relationship of each of its constituents to one another. For example, can you tell me what is this structure here? That's the kidney, isn't it? This kidney, it is on the posterior abdominal wall. So, you have the vertebral column, right? In the region of the lumbar vertebral column, right? And this one is the inferior vena cava, and to the left of it is the abdominal aorta. This is the right kidney, this is the left kidney. Sitting on top of it, you can see the adrenal glands, right? So the relationship of the kidney, the right kidney related closely to the inferior vena cava, the left kidney to the abdominal aorta, and above the kidney, the suprarenal gland. Also, the relations of the kidney to its surrounding structures is important, because if you want to perform a surgery over the kidney, right, how to approach the kidney. So this is the kidney again. This is the inferior vena cava, and here's the aorta. This is the lumbar vertebra. Relationship, it forms a very, very important component. Okay, because yes, while doing a surgery over the kidney, you can accidentally injure the nearby structure. So to be aware of the relationship is important. Yes, now let's move on to the subdivisions of anatomy. Gross anatomy is what you're doing daily in your dissection, all right? Looking into the cadaver, you dissect it layer by layer, and then you get to see and feel. You must, of course, have noted the difference between the feel of an artery, the vein, the nerve, the muscle, the tendon. So all that is gross anatomy. Histology also you must have started where you go for your histology lab. Through the microscope, you look into these slides. You see a lot of pink and blue. Yes. So you study the structure of the tissue, the cartilage, the muscle, the nervous, the lymphatic tissue. Okay. So only when you know the normal histology, later on when you move on to the first clinical, right, you'll be able to identify the abnormal, the pathology part of it. Clinical anatomy, what do you mean by clinical anatomy? Of course, every part of anatomy has to be correlated with clinical anatomy when you approach a patient, isn't it? Okay, for example, you can see the lung, the ash shadow here, these are the lungs, right? The right and the left lung, the right lung, the left lung. And here, what has happened to the right lung? The lower part of it, yes, there is fluid in the pleural cavity. This condition is called pleural effusion. So here what you do, you put a needle into the pleural cavity and aspirate the pleural fluid. So the patient is going to come to you with complaints related to pleural effusion. Yeah, difficulty in breathing, cough, all that. And yes, you diagnose it as pleural effusion, and then you should be able to aspirate the fluid, isn't it? So doing this all, your normal, your basic anatomy is essential to build up the clinical anatomy. Because when you do this procedure, the pleural tapping, you should know exactly where to put the needle to aspirate the fluid. Where does the lower border of the lung, where is the lower border of the lung? Where is the lower limit of the pleura? Okay, and what are the structures that lie beneath the pleura over the right and the left side? The position, the point where you insert the needle is very important. For that, you should have a thorough understanding about the anatomy of the lung, pleural cavity, and so on. Radiological anatomy again. Yes, just now we saw the normal lung and the one with pleural effusion, as I told you, right? The lower part filled with pleural effusion. Here again, what is the abnormality? You know, definitely there's something abnormal, right? So this is metastasis in a malignancy. It can be a breast malignancy with deposits over the lung, right? And here, what abnormality do you make out? Cardiomegaly, right? Abnormally enlarged heart. So radiology, yes, you'll be able to differentiate it whether it's normal or abnormal. For that, you should have a basic understanding of the normal anatomy. Embryology is again another interesting part of anatomy. So we know that the sperm and the ovum fuse to form the single cell zygote, which is then going to form the bilaminar germ disc, the trilaminar germ disc, and then the entire growth of the fetus within the utero. We are going to study it as embryology. Surface anatomy. So here in this picture, you see the liver. You should be able to mark out the borders of the liver over the surface of the cadaver. Why so? A person is coming to you with acute abdominal pain or some abdominal pain. Okay, immediately you put your fingers, okay, right, and ask them whether this area is painful, whether when on pressing that, okay, whether the tenderness is felt. Okay, and you should know the liver is situated, yes, in the right hypochondrium, also extending to the left lobe of the liver. So in cases there is going to be enlargement of liver, only when you know the contour of the normal border, you can make out an enlarged liver also. So surface marking is another important component of anatomy, and the surface marking of these structures will be tested in your practical examination. Regional anatomy is what we'll be doing, learning anatomy in regions. So you must have started limbs, isn't it? The upper limb, the lower limb, and then we move on to the thoracic cavity, abdomen, right? Head, neck. We open the vault of the skull, enter the cranial cavity, and also learn about the brain and the meninges, the neuroanatomy. Okay, so the head, the neck, the neuroanatomy, the thorax, abdomen, which also includes the pelvis and the perineum, and the limbs, the upper limbs and the lower limbs. We study anatomy in regions. Another interesting part of anatomy is living anatomy, where you get to see the anatomy of these structures in a living individual by inserting an endoscope. You get to see the interior of these structures. Okay, so here you can see the endoscope pass through the esophagus into the stomach to visualize the stomach here, right? And here, this is the epiglottis that is situated behind the stomach, the true vocal cords, the false vocal cords. These are the true vocal cords. Okay? And here again, this, can you tell me what could it be? The larynx is going to continue as the trachea. What happens after that? The trachea is going to bifurcate, right, into right and left principal bronchus. That is what you see here, the bifurcation of the trachea into the principal bronchus. So why do we do this? We don't do it normally, right? So when a patient comes with symptoms related to the viscera, you want to study whether there's any pathology, any abnormality within it, whether there's any stenosis, a stricture, a foreign body, ulcer, or perforation, okay, all that. Systemic anatomy, so I told you that the anatomy can be learnt in regions, right? Head and neck, neuroanatomy, limbs. This is another way of learning anatomy in systems. For example, you would have done in your 12th grade, right? Learning anatomy in systems, respiratory system, cardiovascular system, and nervous system. Yes, all that. Skeletal system. So what is about this anatomical terminology? Yes. So it is a common term that can be used by people like speaking different languages. Okay, so for understanding, and most of it is going to be derived from Greek and Latin. And the reference guide for anatomical terminology is a book published in 1998 by the Federative Committee on Anatomical Terminology. So here, this muscle over the shoulder that you see here is the deltoid. So a person speaking French, a person speaking Danish, a person speaking English, everyone going to call this muscle over the shoulder as deltoid, right? So deltoid is the muscle into which you give the intramuscular injections in the arm. This is again very important. Okay, so what is anatomical position? When I say the inferior vena cava, we saw a picture of it, right? It lies to the right of the abdominal aorta. Or when I say the adrenal glands are situated over the top of the kidneys. Okay, so everything, whatever I describe, I refer it in terms of the anatomical position. So what is this anatomical position? As you see here, imagine a person standing erect, right? The eyes looking straight and forward. Upper limbs, the upper limb should be by the side of the body with the palm facing anteriorly and both the feet together. I'll repeat it again. The person, whenever you're describing any terms, okay, any organ, any viscera, we describe it in terms of anatomical position. We imagine the person to be standing erect, eyes looking forward, upper limb by the side of the body, palms facing anteriorly, and the feet together. Fine? Anatomical planes is again very important, because now, as you said, you'll be learning about specimens orientation in the cadaver, right? Okay, when you go for radiology, we'll also get to do like CT, MRI, different sections taken in different planes, and all your image based questions that come for your competitive examination, again orientation to it. So what are the three basic planes that we're going to learn in anatomy? Okay, the sagittal plane, the coronal plane, and the transverse plane. So what is the sagittal plane? The sagittal plane, okay, it is an imaginary vertical plane that divides the body into a right and left half by passing through the midline. Is that clear? Okay, the sagittal plane, the mid-sagittal plane passing through the midline divides the body into a right and left half. What is coronal plane? So this is the coronal plane. Again, it is an imaginary vertical plane perpendicular. So the sagittal plane was like this. The coronal plane is perpendicular to the sagittal plane, dividing the body into a front and back. The transverse plane or the horizontal plane, yes, it divides the body into a superior half and inferior half. Fine, so these are the three basic planes that you should definitely know. Moving on to the terms of direction or relationship. Superior, inferior. It is equivalent to the terms cranial. Superior refers to cranial or cephalic, nearer to the head end. Inferior or caudal, nearer to the tail end or the foot end. So here, you know, the bones that make up the skull, they are superior, whereas the bones that make up the foot, they are inferior. Again, this, what you see here is the hip bone. The hip bone has three parts. This fanned out portion is ilium. This one here is the pubis. This one here is the ischium. So if I'm going to ask you which one is more superior or cranial, which one will you tell? The ilium, isn't it? And cranial or caudal, head and tail end, usually you'll be learning it in your embryology. This is the head end of the embryo, cephalic or cranial. And this is the tail end of the embryo, which is caudal. Okay, inferior. Anterior or ventral. It refers to the front of the body, or which is situated closer to the front of the body. Posterior or dorsal, the back of the body or situated closer to the back of the body. So here you can see the person scanning. Okay, this is the ventral surface of the human body. And here, this is the back, right? The dorsum. Now, can all of you take your fingers and put it over here and tell me what is that structure you feel here? The windpipe, the trachea. And what is situated behind that? The esophagus, the foot pipe. So now you can tell me which one is anterior? The trachea. Which one is posterior? The esophagus. Can I show you both here now? So this one here is the trachea, the windpipe. Why do you get to feel it so hard? It's made up of the hyaline cartilage. And this one here is the esophagus, the foot pipe. It's a muscular tube, right? Okay. So the trachea is anterior and the esophagus is posterior. Okay. And here again, this is a picture of the embryo. Okay, the fetus, yeah. And here, for the embryo, this is going to be the ventral surface. The front of the embryo, right? And this is going to be the dorsal surface of the embryo. Understood? Front and back. Moving on to the next terminology, medial, lateral and intermediate. I'm going to define and you're going to give me an example. So you know there is a midline. Anything closer to the midline, we call it as medial. Away from the midline, it's going to be lateral. I'll ask you. So here, in the arm, you get to see one bone, the humerus. In the forearm, there are two bones, isn't it? What are they? Radius and ulna. Okay. So this one here is the ulna and this is the radius. Here again, if I want to mark it, this is going to be the ulna and this is going to be the radius. Now my question, which one is medial and which one is lateral? The ulna is medial and the radius will be lateral. Okay? Intermediate is like between the two. And yes, few other terms, very simple, easy terms, but we get to use it frequently later, right? The anterior surface, the ventral surface of the hand, we are going to call it as palm. Whereas, yes, the back of the hand, dorsum. Similarly, in the foot, okay, this will be the sole of the foot and this is dorsum. You'll be learning in embryology that the upper limb bud will undergo a rotation. So the dorsal surface, it becomes more anterior and the ventral surface, it goes behind. Okay, so this is the sole and this is the dorsum. The superior surface of the foot is the dorsum. The inferior surface is the sole. Supine position and prone position. Supine position is lying on the back. Prone position lying with the face downwards. Okay. So in certain surgeries, we might require to put the patient in the prone position, especially the spine surgeries. Coming to terms of comparison, proximal and distal. What do you mean by proximal? Something that's closer to the body and distal is farther away. For example, in upper limb, we would have learned that this is the shoulder, the arm, right? And this is your elbow, the forearm, and the hand. Can you tell me which one is more proximal to the body? The shoulder. Which one is distal or away from the body? The hand. Superficial is something that's closer to the surface and deep away from the surface. So in your dissection, you would have dissected, right? Layer by layer. So what are the layers you dissect through? Skin, superficial fascia, deep fascia. Once you cut the deep fascia, you would have come across the muscles, isn't it? Right? So, and you would have seen the superficial veins and deep veins. For example, in the upper limb, what are the superficial veins? We have the cephalic vein and basilic vein. And the deep veins will be accompanying the artery, accompanying the brachial artery, accompanying the radial artery, ulnar artery. The axillary vein is again a deep vein. So how we call it as superficial or deep? In relation to the, yes, deep fascia. The superficial veins, they lie superficial to the deep fascia, and the deep veins, they lie deep to the deep fascia. Also, the deep veins are like farther away from the skin, farther away from the surface, and the superficial veins are closer to the skin, isn't it? So anything closer to the skin or surface, we call it as superficial, away from it, deep. And this, do you remember the case of pleural effusion and tapping the pleural fluid? Okay, you will be asked, what are the layers pierced by the needle when you do a pleural tapping? So yes, it begins from the skin, the superficial fascia, you'll get to see the muscles, right? Muscles of the chest wall, and then the intercostal muscles, okay, and then the parietal pleura, and then you'll enter the pleural cavity. The layers pierced by the needle from superficial to deep during the pleural tapping, right? Internal and external. Internal, we are looking into the interior of an organ or cavity. External, towards the external features, the surface of the organ or a cavity. So you see, this is the stomach. Part of it has been opened. You will get to see the mucosal folds here. They are called the rugae, the temporary mucosal folds. When the stomach is empty, you get to see these folds. When the stomach is full and distended, these folds disappear, the temporary mucosal folds. The gastric rugae, while looking into the interior of the stomach. Terms of laterality. When something is present on both the sides, we call it as bilateral. And only on one side, we call it as unilateral. The lungs are bilateral. The heart is unilateral. In the abdomen, the kidneys we saw, right? Right kidney, left kidney, bilateral. The stomach is present on the left. And this one here, any idea what is it? The spleen. It's present only on the left side. Ipsilateral, contralateral. So can you see here, this is the cranial cavity. And what do you get to see here? The brain, the cerebrum. You can make out the cerebrum here. You can make out the cerebellum here, right? So we know that the forebrain, it consists of the cerebrum, cerebral hemispheres, right and left cerebral hemispheres. You know what? The right cerebral hemisphere has control over the left side of the body. If there is injury to the right cerebral hemisphere, the patient will not be able to move the left side of his body. Whereas the cerebellum has control over the ipsilateral body. The cerebellum also has a right cerebellar hemisphere and a left cerebellar hemisphere. The right cerebellar hemisphere has control over the right side of the body. When it is on the same side of the body, we call it as ipsilateral. Remember, the right cerebellum has control over the right side of the body. Similarly, okay, what is contralateral? The right cerebrum, okay, the right cerebrum has control over the left side of the body. This is called as contralateral. The right cerebellum has control over the right side of the body. This is called ipsilateral. Terms of movement, where does a movement take place? At the joint where two or more bones meet, articulate, isn't it? So what do you mean by the term to flex or to extend? When you flex, okay, so this is the ventral surface of the arm, this is ventral surface of the forearm. I'm bending, I'm reducing the angle between the ventral surface of the arm and forearm. This is called flexion. When I'm straightening it out, I'm calling it as extension. Flexion, extension, okay. Dorsiflex and plantarflex. So I was telling, like, remember, this is called the dorsum and this we call it as the sole. So when the dorsum of the foot is lifted up, this is called dorsiflexion. The sole is also called as the plantar surface. The dorsum of the foot is elevated up, it's called dorsiflexion. When it is put down, it is plantar flexion. This dorsiflexion and plantar flexion, it takes place at the ankle joint, okay? Abduction and adduction. So this is the midline of the body, right? So to move your arm closer to the body is adduction. Taking it away from the body, that is abduction. Then what is medial rotation and lateral rotation? Okay, so what happens in medial rotation? So this is the anterior surface of my arm, right? I'm turning it in such a way that this ventral surface of the arm, it comes in close contact with the body. When I'm turning it in the opposite direction, the ventral surface of the arm is turning outwards, right? This is called lateral rotation. Medial rotation, lateral rotation. Circumduction is a combination of all the movements, okay, so that the distal part of the limb, when you perform it, it makes a circle. Inversion and eversion, this is again taking place at the foot, right? So you know what is dorsum of foot and what is sole, right? So inversion, what is happening? So this is medial. You can see the great toe. The great toe on the foot is medial. Your little toe is lateral, right? You can make it out, right? The great toe, the little toe. So this is going to medial. When the sole of the foot, it turns medially, that is called inversion. When the sole of the foot is turned outwards, then that is called eversion. Supination and pronation, right? So we remember the anatomical position, the person standing erect, eyes looking straight forwards, the upper limb by the side of the body, and the palm facing anteriorly, right? When the elbow is flexed, when the palm is facing superiorly, that is also called supination. The reverse of it, when the palm turns posteriorly, or when the palm is put inferiorly, that will be called as pronation. Supination, pronation, right? Protraction and retraction. Here it is, this movement is going to be related to the scapula. So you know this is the midline. This is the scapula. You can see these are the ribs attaching to the vertebral column. The scapula can slide over the chest wall. Okay, so the movement of the scapula away from the midline, it is called protraction. The movement of the scapula towards the midline, that is called retraction. Okay, so here you can see the scapula is moving away from the midline, it is protracted. Okay, so here again, when you're trying to place your hands on the wall and push it, right, you can feel the scapula moving away from the midline, protraction. Okay, and when you try to take your elbows backwards, you can feel the retraction of the scapula moving towards the midline. Protraction, retraction. Protrusion and retrusion is related to the mandible. The mandible moving forward is protrusion, putting it back into position is retrusion. Apposition, reposition in relation to the thumb, where the pad of the thumb comes in contact with the other digits, that is apposition, right? Reposition is the opposite movement. Shall we work out few questions now? Yes. The coronal plane, it divides the body into a front and a back, anterior and posterior. Movement of the foot in a way that the sole faces laterally, it's called eversion. I haven't labeled it, a minute please. In the given image, which of the following is the medial most structure? Yes, by looking into the color of the image, you'll be able to tell this is a vein, this is an artery, and this is a nerve. Of course, this is the muscle, isn't it? Okay, so here, this is the region of the front of the thigh showing the femoral vein, the femoral artery, the femoral nerve, and this is the sartorius muscle. Need not worry about all the names now. You can tell me which is medial most, isn't it? So here again, this is the region of the hip joint. You can see the femur, right? This will be the midline of the body. This is lateral. The medial most structure in this given image is the vein. Fine. So in this session, we have learned the basic terms used in our anatomy. Okay. So we started with how do you define anatomy, and then the subdivisions, the various subdivisions of anatomy, and then we moved on to anatomical position, anatomical planes. What are the three basic planes? Yes, the sagittal plane, the coronal plane, and the horizontal plane. And then different terms of comparison, relationships of movement, all that, right? So hope you understood. Happy learning. Thank you.